Hello guys, Dr. Rahul this side. So in this video I will discuss about immunostaining and histopathological staining, right? So I will take all the important stains here and I will also show you few images, right? Relevant images. So one second. Yes. So I will start with few tumors and the immunostaining. So if I tell about epithelial tumors, so for epithelial tumors the staining will be pancreatin, EMA, it is epithelial membrane antigen, CEA is carcinoembryonic antigen, and NSC, this neuron specific annulase. Anyway, these three is important. Pancreatin, so for epithelial tumor it is pancreatin, epithelial membrane antigen, and carcinoembryonic antigen, right? Now talking about next tumor, I will go to mesenchymal tumor. So for mesenchymal tumor it is vimentin and desmin. Desmin mainly for myogenic origin tumors like rhabdomyosarcoma, right? So for mesenchymal tumor we have got vimentin, we have got desmin. For special tumors like so for special tumors like melanoma, we have got HMB45, S100 and vimentin, with HMB45 being the most important one, right? So we'll come to the picture, one second, right? For lymphoma, so for a lymphoma we got LCA as leukocyte common antigen, pan B, pan T, and CD15 and CD30. So as you know, CD15-30 is for, yes, right, RS cells, which is for Hodgkin's lymphoma, right? And for neural and endocrine elements we got neurofilaments like GFAP, glial fibrillary acidic protein, and chromogranin. So I will repeat, one second. Yes. Okay, so I will repeat this, that for epithelial tumors we have got pancreatin, epithelial membrane antigen, carcinoembryonic antigen, NSC, and for mesenchymal tumors we have got vimentin, desmin, with desmin for tumors with myogenic origin. For neuroendocrine tumors we have got glial fibrillary acidic protein. For melanoma we have got HMB45, S100. For lymphoma we have got leukocyte common antigen, pan B, pan T markers, and CD15, CD30 markers as well, which is the markers for RS cell and Hodgkin's lymphoma, right? Okay, so now we will go to the images, right? Okay, so let me take a pen. Okay, so see this one is amyloid. Now amyloid, the stain is Congo red, but also you should remember that this image is has not been asked. You know, the image that is asked mostly is this one, amyloid in polarized light that shows apple green birefringes. I will try to show it in my future videos. So this one is of Congo red stain, another is of the image in polarized light that shows apple green birefringence of amyloid, right? This one is Elsian blue. Elsian blue is used in Barrett's esophagus to find out the glandular epithelium. It is seen as slightly bluish, so this one is Elsian blue, right? And this one is, I think, pus stain. Okay, and this one is for mucin, for for seeing the mucus, right? And this one is oil redo stain for staining the fat, right? And this one is the reticulin stain for staining the reticular fibers that appears blackish, right? You can see little blackish, right? And this one is Vernhoff stain. So Vernhoff stain is used for staining the elastin, right? Elastin. This one is Mason's trichome stain, right? This one is Mason trichome stain for this one for collagen, for staining the collagen, right? This one is Prussian blue stain. I am telling you the most important stains, right, that has been asked. So this one is Prussian blue stain that stains the iron as blue. As you can see, this one is the blue colored, sky blue colored. This one is the iron. So it stains the iron in blue colored as blue colored pigment in sideroblastic anemia, right? And this one is again this one is Mason Fontana. Okay, this one is von Cosa. The von Cosa is for calcium, right? And this one is what is this? Yeah, this one is AFB stains. So this one is AFB for Jill Nielsen, where you can see red rod shaped red rod shaped bacilli in a blue background. This one is rhodamin stain. So rhodamin stain is used for it's used for copper, right? And this one is stain for fungi. So this one is stain for fungi where we are seeing the hyphae and things. So it is actually chalcofluor white stain, I think. And this one is Warthin-Starry silver stain. One second. Yes, this one is Warthin-Starry silver stain, where we can see the this one H. pylori stained as this one black in a yellow background, right? This one is gram stain for staining the gram positive and gram negative bacilli. So important ones are the amyloid, which I discussed, Elsian blue, the pus stain, mucin, and oil redo, reticulin stain, right? In von Cosa, then Mason Fontana, right? Mason trichome, Vernhoff, and AFB, yes, and chalcofluor, this Warthin-Starry silver, right? So these are few important ones which you should not miss. And there are other stains like stains like this one India ink stain. Okay, let me write it, right? It will be easier. Let me take another. Yes. So other stains I am writing here. One second. Okay. So other stains are like India ink. India ink is for Cryptococcus, right? So India ink is for Cryptococcus, right? India ink for Cryptococcus. And with Mason Fontana we can see melanin, as I already told. And there is toluidine blue stain. Toluidine blue stain is used for this one mast cell, right? Toluidine blue stain. Then for lipid I have already told oil redo, and also there is Sudan black, right? So for lipid we have oil red O stain, and also there is Sudan black, right? So these two stains for lipid, right? And H. pylori we can see with Warthin-Starry silver stain, as I already mentioned. Pus stain is used for viewing the glycogen or basement membrane. Rhodamin for copper. Prussian blue for iron or hemosiderin. right? Bone cosa for calcium, already mentioned. Alcian blue for this one, Barrett's esophagus, or mucin, right? Then Varanov stain for elastin, reticulin stain for fibrosis, for viewing the reticular fibers, billion crescent blue for reticulocytes, right? This one is important for viewing reticulocytes. We use brilliant crescent blue for reticulocytes. So I think I took all the important stains in one slide. So I hope it will be helpful, right? So we will meet in another video, right? Thank you.